Today in the United States, few people understand or can agree about Obamacare. In fact, 4 out of 10 Americans are unaware of the current status of the healthcare law, whether it's been overturned by the Supreme Court or repealed by Congress. This video was created to help Americans understand the Affordable Care Act, as Obamacare is officially called, and consider its fiscal and moral trade-offs. The ACA was passed by Congress and signed into law by President Obama on March 23, 2010. It was designed to respond to the rising number of uninsured Americans and the rising costs of healthcare. The ACA is the most significant overhaul of the U.S. healthcare system since 1965, when Medicare and Medicaid were created by the Lyndon Johnson administration. Medicare provides healthcare to the elderly, and Medicaid provides healthcare to the poor. Universal healthcare is usually depicted as a Democratic cause, but over the past 50 years it has been supported by Democrats and Republicans. While LBJ, a Democrat, created Medicare and Medicaid, Richard Nixon and George Bush, both Republicans, expanded Medicare to cover more disabled people and to pay for prescription drugs. And it was Ronald Reagan who required hospital emergency rooms to treat all patients, regardless of their ability to pay. There are about 266 million Americans under the age of 65. About 56% have health insurance through their employers. 21% are covered through Medicaid or other government programs. 18%, about 50 million people, are uninsured. The ACA uses 3 tools to increase healthcare coverage and affordability. These tools are mandates, health insurance exchanges, and Medicaid expansion. Let's start with the mandates. First, there's the individual mandate, which requires that by 2014, uninsured Americans get health insurance or pay a penalty of about 1% of their income, going up to 2.5% of their income by 2016. Who are the uninsured? They are mostly low income, but many are in the middle class. About 38% have incomes under $22,000 for a family of 4, which is below what's called the federal poverty level. What about the ages of the uninsured? Well, the largest group are the middle-aged. After them, the 2 largest groups are young adults. 57% of the uninsured are employed. 80% are U.S. citizens. The ACA's second mandate requires that, come 2015, employers with 50 full-time workers or more provide health insurance or pay a penalty of about $2,000 per worker, excluding the first 30 workers. Currently, more than 90% of companies with more than 50 workers provide health insurance. The second tool of the ACA is the health insurance exchanges. These are websites that will be run by the state or federal governments. They will be a place where insurers can advertise and sell their coverage options. Starting October 1st, individuals and families will be able to choose from 4 plans: Bronze, Silver, Gold, and Platinum. The plans will vary in quality and in cost. As this chart shows, the Gold plan covers 80% of healthcare expenses, whereas the Bronze plan covers only 60%. Insurers accepted to the exchanges must offer a package of benefits. This includes emergency, maternity, pediatric, preventative, prescription drug, and mental health benefits. Insurers cannot deny coverage to people with pre-existing conditions. The Congressional Budget Office now estimates that 26 million people will enroll in these exchanges. The exchanges sell health insurance at a price that depends upon income. A lower income person will pay a lower premium. This is achieved through subsidies and spending caps. For example, the health insurance premium for a family of 4 who makes about $35,000 a year will be 4% of their annual income, or about $1,400 a year. Their maximum out-of-pocket spending limit will be about $4,000. The rest of the family's premium health expenses, or about $10,000 a year, will be subsidized through tax credits. A third tool of the ACA is the expansion of Medicaid. As you can see from this chart, Medicaid currently benefits mostly poor children, pregnant women, and people with disabilities. Children, on average, qualified for Medicaid in 2012 if their family's income was below 250% of the federal poverty level. For a family of 3, this equaled $48,000 a year. Eligibility decreases significantly for working parents and jobless parents. Adults who do not have children and are not disabled do not qualify for Medicaid, regardless of their income. The ACA's biggest change to Medicaid is that it enables more people to qualify by raising the minimum eligibility to 138% of the federal poverty level, or about $15,000 for an individual, and $26,000 for a family of 3. The ACA was complex enough, but in June 2012 it got more complicated. The Supreme Court decided that the individual mandate, which requires Americans to obtain insurance, was authorized by Congress's power to levy taxes. But the court also decided that states could opt out of Medicaid expansion. The court reasoned that forcing states to expand Medicaid or lose their current Medicaid funding was an invalid exercise of Congress's spending power. The decision essentially cut the power of the ACA in half. Why did some states opt out of Medicaid expansion? The ACA was complex enough, but in June 2012 it got more complicated. The Supreme Court decided that the individual mandate, which requires Americans to obtain insurance, was authorized by Congress's power to levy taxes. But the court also decided that states could opt out of Medicaid expansion. The court reasoned that forcing states to expand Medicaid or lose their current Medicaid funding was an invalid exercise of Congress's spending power. The decision essentially cut the power of the ACA in half. By the summer of 2013, nearly half the states in the USA opted not to expand their Medicaid numbers. Decisions have fallen largely along partisan lines. All states with a Democratic Congress and governor opted into Medicaid expansion. Most Republican states opted out. Most undecided states are either Republican dominant or have power divided between the parties. These decisions have been determined by political and fiscal views. Arizona, for example, is a red state that will expand Medicaid. Governor Jan Brewer explained that this will, quote, protect rural and safety net hospitals from being pushed to the brink by the growing cost in caring for the uninsured, take advantage of the enormous economic benefits by injecting $2 billion into our economy, save or create thousands of jobs, and provide healthcare to hundreds of thousands of low-income Arizonans. Maine, which has a Republican governor and a Democratic Congress, opted out of expansion. Governor Paul LePage argued that Maine has expanded Medicaid before, and it didn't work. He said, quote, Maine ran up massive debts to our hospitals as the system outgrew taxpayers' ability to pay. The uninsured population remained almost the same. The only change was thousands upon thousands of Mainers leaving the commercial market for free healthcare, expanding the welfare rolls from nearly 200,000 to 338,000. What are these disagreements about? We think they're about 1, whether the privately insured should pay for the publicly insured, and the healthy should pay for the sick. 2, whether healthcare is a government responsibility. And 3, whether and how healthcare costs can be brought down. Because of the Supreme Court's decision, the ACA will have vastly different effects on different states. Residents in opt-out states with incomes below 100% of the federal poverty level, but above their state's own Medicaid eligibility levels, will not receive federal subsidies for the health insurance exchanges. Texas, California, Florida, New York, and Georgia would have the highest drop in the uninsured if they expanded Medicaid. This graphic shows the reduction of uninsured people without any Medicaid expansion, and the additional reduction if all states had expanded Medicaid. The Congressional Budget Office now estimates that expansion will increase Medicaid enrollment by 12 million people nationwide. Opponents of the ACA argue that its cost is fiscally irresponsible, especially to our already indebted federal government. For the first 3 years of the expansion, the federal government will provide the states 100% funding, and 90% thereafter. Participating state governments will have to pay half of the expansion's administrative costs. As this chart shows, the lion's share of the Medicaid expansion cost, $931 billion between 2014 and 2022, will be borne by the federal government. Opponents of the ACA also say that it is fiscally irresponsible for the states, which spend, on average, 25% of their budgets on Medicaid, making it the single largest state spending category. Under the ACA, state Medicaid spending is projected to increase for 42 states. 8 states, however, New York, Massachusetts, Vermont, Delaware, Maryland, Maine, Connecticut, and Iowa will end up spending less on Medicaid expansion because federal dollars will subsidize their current Medicaid commitments. With or without the ACA, total U.S. healthcare spending is projected to rise from $2.8 trillion in 2012 to $4.8 trillion by 2021, an increase of about 70%. Estimates show that the ACA would cost Americans $486 billion more between 2013 and 2021 than no reform. How will the ACA affect those with private insurance? The privately insured will pay for the publicly insured. As this chart shows, publicly insured patients have what's called a negative payment to cost ratio. In other words, the cost of treating Medicare and Medicaid patients is greater than the payments received. The result is that costs are shifted to privately insured patients, who pay about 130% the cost of their care. Can the ACA bring down healthcare costs, or will costs go up? Health and Human Services is reporting that consumers saved $3.4 billion in 2012 in lower premiums, and $500 million in rebates. They say that these are both because the ACA requires insurance companies to spend 80% of their premiums on medical care, or pay a rebate to policyholders. This brings us to the last big disagreement: whether healthcare is a government responsibility. Those who say yes cite the preamble of the U.S. Constitution, which states that the Union's purpose is to promote the general welfare, as in the case of public education. Others say healthcare is not a government responsibility, because promoting the general welfare should not be interpreted as providing or paying for it. Texas Governor Rick Perry, for example, sees the ACA as an infringement upon individual and state rights. He's argued that expanding Medicaid would hold Texas hostage to the federal government. It would benefit no one in our state to see their taxes skyrocket and our economy crushed, he said. Other politicians, like Arkansas Governor Mike Beebe, said that Obamacare and Medicaid expansion is good for our people because it's helping folks that don't have insurance now and that are out there working their tails off. Arkansas's Medicaid program is facing a shortfall of $298 million in 2014. Beebe said that increased federal dollars for Medicaid expansion would help reduce this shortfall. What do you think about the ACA and its trade-offs? Is expanding Medicaid wise? Can health insurance exchanges bring down costs? Are the fiscal and moral questions here similar to other issues facing our nation? We invite you to take your ideas to the maker of this video, 22nd Century. 22nd Century's mission is to inform and engage Americans. Because if we are to get to the 22nd century, America must understand and act on the trade-offs of this one.